Hi, my name's Dana Aiken. I'm the Total Joint and Spine Coordinator at Beaufort Memorial Hospital. I'm also a registered nurse. Today, you are tuning in to our joint pain and treatment seminar. You've probably joined us today because you are experiencing some sort of joint pain or something's bothering you. So we are hoping to provide you with some information, helpful tips, and help you decide if seeing an orthopedist is something that you need to do. So, how many Americans do you think are living with joint pain today? It's actually a very large number. About 21 million Americans are living with some sort of joint pain or complications. So to understand the pain, it's really important to first understand the joint anatomy. Today we are going to talk about our knees and our hips. We do have other joints that hurt as well, maybe your shoulder, things like that. But our knees and our hips bear the weight of our body, so they take a lot of the brunt, and they're usually the most common areas that we have the pain. But we can definitely help you with any problem that you're having. So we're going to first look at a healthy knee. So the knee has three major bones, the femur, the patella, and the tibia. Around your knee, there's several ligaments and cartilage that help support your knee. We have the lateral meniscus, the articular cartilage. The articular cartilage is kind of if you eat a chicken wing and you kind of tear off the bone. If you have that nice shiny cartilage on there, that would be kind of what the articular cartilage would look like. Over time, we just naturally have that wear and tear, kind of like the tread on a tire. It just wears down and just doesn't provide that absorption and that friction like we would like it to. So that can cause some pain. The healthy hip, the hip is a ball and socket joint, so constant movement there with your rotation. You have the pelvis, the femoral head, the femur, and then the socket. So again, the hip over time, that wear and tear with that ball and socket joint. The shoulder is very similar, ball and socket, to the hip. And just over time, you have that wear and tear. So the osteoarthritis kind of kicks in, and that can definitely cause some pain. You usually have like the nice fluid in between the bone. And as that wears down, it kind of becomes bone on bone. So you could be feeling some of that. So why do joints hurt? I kind of mentioned that already, but we're going to get into it a little bit further. So you've probably at some point, if you've been to the doctor, especially heard arthritis. So arthritis is a big reason why our joints hurt, and it's just inflammation of the joint. So arthritis is just anything that causes inflammation in a joint. If you're up, especially now you hear late at night or just anytime, a lot of the infomercials or medicines, creams, a lot of products are out there because a lot of people are experiencing that joint pain. So there's several types of arthritis. How many different types of arthritis do you think there are that you could think of? Well, there are about 100, according to the American Arthritis Association, there are about 120 different types of arthritis. So some you may have heard of, some maybe not. These are anything, remember, that causes inflammation in the joint. So the rheumatoid arthritis, some of the juvenile arthritis. Today we're going to talk about three common, the most common arthritis that people are familiar with or know, or the things that are probably bothering you. So we have first rheumatoid arthritis. Rheumatoid arthritis is an autoimmune genetic arthritis. It is something that is very hard to diagnose sometimes because it attacks the lining. So the body is attacking the lining in our joints. And so a lot of times you'll have multiple joints that will be affected by the rheumatoid arthritis. Rheumatoid arthritis has come a long way. There are a lot of medications out there that people are taking so they're able to live a better quality of life. We have the post-traumatic arthritis. So if you're an athlete, if you've been in a car accident, if you've had any kind of trauma to your joint area, that would be, the post-traumatic arthritis, that football knee, that tennis elbow, golf shoulder, things like that. If you've been on a ski trip and fractured your ankle, all of those things. And then we just have the osteoarthritis, that normal wear and tear. We call it the disease of privilege. Usually if you live to be a certain age, you're going to deal with this in some form or fashion. When it starts to affect you depends on a lot of things. It depends on your health overall. It depends on your lifestyle. If you're someone who's very active, you might wear your joints out a little bit faster. If you're someone who is a little bit more overweight, your weight is bearing on those joints and your joints might wear out a little bit faster. So it just, lots of factors there. About 80% of adults have osteoarthritis by the age of 60. We, again, just wear out our joints over time. And the studies show that it affects women as much or twice as much as men. I don't know if that's because we maybe are more verbal and go to the doctor a little bit more, but that is something that the studies do show. So again, here's just an image of the healthy knee versus the arthritic knee. You can see the healthy knee is kind of nice and lined up. Where the arthritic knee is not as in line. Your body is overcompensating for that wear and tear. Over time, you see that you have the narrow joint space here. So in the healthy knee, nice and in line, you have that nice joint space, the fluids there. In the unhealthy knee, you have that narrow joint space and your body's again overcompensating and it just kind of lands where it does. Your body can also create some bone spurs. Those bone spurs can break off and become very painful in your joint. So kind of same concept as like if you're at the beach and you get a piece of sand in your eye, that bone spur breaks off and it's just rubbing in your joint, and that can be very painful. So if you don't, do anything differently, your body again is just trying to adjust to what's going on and it's causing you pain. So a lot of times one of the first steps will be to have an x-ray. Your x-ray doesn't tell you everything, but it can give us a good idea. It's usually a great starting point. You can see an x-ray here of the healthy knee again versus that arthritic knee. The healthy knee has that nice space between it, where you can see over here the arthritic knee is not in line and doesn't have that nice space. You can also see some of the bone spurs in the x-ray here as well. So here we have an image of a healthy hip versus the arthritic hip. Again, hip's the ball and socket. It has that lots of movement there and rotation. So the arthritic hip here has the destroyed cartilage. It's almost the bone on bone there. You can see the narrow joint space and a lot of the bone spurs that are starting to form that again can break off and become very painful. This is a x-ray of the healthy hip versus the unhealthy hip. In the unhealthy hip, you can almost see where you can't see the head of the femur in that socket. They're almost merged to one. So all that nice space that we want you to have has worn down and is no longer there. So again, narrow joint space, and then you can pick up the bone spurs in that image as well. So what are some other causes of joint pain? There might be some other things that you're experiencing and that you would want to think about before just jumping in to say, my hip hurts, I need to have surgery. So some things that we see very often are bursitis. So Bursitis is just the inflammation of the bursa. Our knee has the 4 bursas here, and the bursas kind of act as like a coaster on furniture, kind of to help absorb some of that friction and movement there. So a lot of times we'll see the prepatellar bursa. It can become inflamed or irritated if you're somebody who works in the yard or has been scrubbing floors or does housework on your knees. Though that is something that that might become bothersome and inflamed and cause pain. So we also have the bursas in our hip. Those can also become inflamed if you're laying on them too long or have any kind of pressure. So it's usually like overuse or misuse can cause some of these to become inflamed and be very painful. Tendinitis is another inflammation of the tendon that can cause pain. So just like the bursas become inflamed, the tendons can also become inflamed from overuse or misuse. So overuse is just, that repetition. I walked up and down a set of stairs and on the ladder today doing extra work. And then misuse is not using the improper body mechanics. You can have some of this, like we looked at, that nice healthy knee was in line, and as your body overcompensates, you become out of line. So you're not using those proper body mechanics, and then you could have some wear and tear or some pressure in some areas that can cause some of these things to be inflamed. So you can have more than one thing going on. It's just kind of, if you've done something, eliminate that, see that if it kind of helps with your problem. And if it doesn't, then that's when you would want to seek and talk to somebody. So you have your tendons here. You have that nice long tendon that runs over the patella. The quad tendon is above and the patellar tendon is below. And then on the hip, we have several. The greater trochanter, the iliotibial band is the one that we kind of hear about the most. And then in the gluteus maximus, we have some as well. So again, if you've been laying on your side for a long period of time, things like that, you might have some irritation there. So you might have some joint pain or some pain due to some injuries. So tendons can become injured, again, overuse, misuse. Your cartilage can become injured, ligaments, muscle injury or muscle tear, that can cause pain as well. Additional causes, spinal problems. So if you have something going on in your back, it might present in your hip or your leg or different areas. So that referred pain, neuropathy. So neuropathy is interruption in your nerve signals. It usually starts distally and works its way up. So you might have something going on there. Nerve injury. So again, pressing on your nerve, something's pressing on your nerve. Nerve injury might be another source of pain. And then it could be vascular. So your blood flow not getting to certain areas of your body, that can be very painful. So you would also, want to make sure it's not a vascular injury that's causing you pain. And then again, referred pain. So lots of times we have people come in and they're like, my knee, it's my knee, it's my knee. And it's not really their knee, it's their hip. So sometimes areas in our body can be painful, but it's really because something else is causing it. So it just depends on, if you go to the doctor and they do the imaging and they're like, your knee's fine, then start to think about, other areas or ask them, to look at other areas as well. So diagnosing joint pain, as you can see, it can be difficult sometimes. There's lots of things that may look similar. There's lots of things that may coincide. So it's just really important to establish a relationship with an orthopedic provider or with your provider so that you can kind of work through some of these things. So diagnosing of the joint pain, it's first important to locate the source. So is it knee pain? Is it hip pain? Is that really what it is? And it's just important to communicate relay what exactly is going on. If it's relieved by, rest, or if it's aggravated, kind of pay attention to all those things, and just communicate that to your provider so that they can kind of figure out what's going on. Again, if you have some buttock pain, that might be a source coming from your back. So back problems often present in that region, that area. Again, groin pain. If you're having groin pain, that could be a sign of a hip problem. So treating the joint pain. So you have all this going on. What do you do? Do you run straight to the doctor or what do you do? What do you do before you get to that point? Or have you done these things? So always we want to look at the conservative measures before anything. So diet. Your diet's very important. And not just the nutrition, but like it's very important to stay hydrated. So your joints with the hydration need the hydration, that fluid, that friction. So it's very important to stay hydrated. Using over-the-counter anti-inflammatories, NSAIDs or creams to decrease some of that inflammation and help with pain. Have you tried any of those? Aspirin is an example, ibuprofen, naproxen, the topical like Bengay, the Icy Hot. You hear all the products that are out there. And if topical is working, great. Just remember with the NSAIDs, you don't want to use them for long periods of time without being under the care of a provider. Sometimes those can, lead to other long-term use, can lead to other things like GI bleeds, or if you, already have some health issues, kidney function, liver function, things like that, would want to be monitored if you're doing any kind of long-term use. So sometimes if the over-the-counters don't work, you may be prescribed a medication such as Celebrex or some compounded creams that are made at the pharmacy. The topical creams. Another conservative measure sometimes is you will see a provider, an orthopedist, and they will maybe inject you with a cortisone injection. So the cortisone injections, usually the providers will only do a couple of those. They might only, tell you had one last month. We have to wait so long before we have another one. They don't really support the overuse of the cortisone injections. That sometimes can deteriorate some of your tissue. So you have to be, careful with those. And sometimes there's only so many that you can have before they won't give you any more in the same spot. And then the plasma and the stem cells. So those are not as popular as like the cortisone injections. They are not usually covered by insurance. They may or may not work. The studies aren't, very supportive of things like that, but people are doing them, kind of injecting those into their joints to kind of prolong the life of your joint. You might also hear a suggestion of viscosupplementation. So that's just where they inject that jelly-like fluid into your joint area. So that also would be something and maybe an option that you could discuss with the provider. Exercise and physical therapy, actually, might try that to see if that kind of relieves some of your pain. Exercise would be the low impact exercises. Those would be something that's good for your joints. You want to keep moving. A lot of times people are like, I'm in pain, I don't really want to move, but that can actually be more harmful. So not exercising can increase your stiffness and your pain. So just a low impact movement is really usually helpful. So what are some things that you want to avoid if you're having this pain? So again, high impact exercises, that like beating down. We say anything that's going to cause you to lift both your feet off the floor at the same time. So you kind of want to stay away from running, any step aerobics, jumping, things like that. So some things you can try instead are low impact exercises. Walking, swimming is really good for your joints, takes a lot of that weight off of you. Biking, and moderate resisted exercise or weight training program. a guided exercise program by a personal trainer. If you do not have somewhere that you go already, we have a fantastic facility, the Life Fit program here at Beaufort Memorial. They have trained therapists in there, physical trainers. They will know how to handle the joint pain. Sometimes you get a prescription to go to physical therapy, or you can just join the gym and just move and do some of these low impact exercises. So if you would like more information about Life Fit or our Life Fit program, you can definitely reach out to me and I'd be happy to point you in the right direction. So let's say we have now tried everything. You have done all the conservative measures. You have rested, you've used ice, you've used the NSAIDs for a couple days, not prolonging them more to 3 days or so, usually 72 hours. If you're not getting any relief, that's when it's time to reach out. And you've done all of those things. You've gotten in front of a provider, and the decision is that you just might need your joint replaced. So that kind of leads to joint replacement surgery. So how many Americans do you think have joint replacement surgery annually? We said a lot have the arthritis. So how many do you think are having their joints replaced? The Americans who have the joint replacement surgery annually are over 2 million. So definitely a need. It does get to that point where that is your option to improve your quality of life. So about 90% of the patients experience pain relief and better mobility. We do track our patients preoperatively 3 months after and a year after. So we really are invested in you, and we really want to see that this joint surgery is doing what you wanted it to do, that you are relieved of the pain, and that you are getting back to your quality of life. So is joint replacement surgery for you? That's a very personal decision and a big decision between you and your family, you and your provider. So one of the questions that you probably want to ask yourself is, do you have difficulty walking, climbing up stairs, rising from a chair? Are normal activities hard for you? We see joint patients come in and have surgery. Anybody from these, I can't do my daily activities, to I'm a golfer and I can no longer swing the golf club. So you have a wide variety of reasons, and it's just, a very personal decision for you. Does the pain affect your daily life or mood? That's really big. So, are you miserable every single day? Maybe that's a reason that you are going to seek a provider and find that this is the decision that's best for you. Do you have severe physical joint damage? Have you had the imaging? Have you gone to the provider? Are they telling you all of these things and it's just not getting better? That might be, something that says, okay, this is time for me to pursue this. You're not having any relief from the non-surgical therapy, those conservative measures that we talked about. You're not getting any relief. That might be a sign that it's time. And a big part of this is, do you have adequate support for the recovery phase? So yes, you're in pain now. Yes, it's debilitating your quality of life. But if you have the surgery, after surgery, do you have the proper support? You would not want to have the surgery, go home alone, and be in your recovery and fall and have something further happen. So it's just something to think about. Do you have the proper means and support for the recovery phase? So some surgical options, if that is something that you and your provider have decided. We have the total joint replacement. So you can see some of the models here. So the hip is the ball and socket. That plastic liner is put in there, and they just take out the part of your joint that was sick and not working like it should have been. So the bad part, they'll just take that out, remove it, and replace it. If you are having this surgery, You have your pre-op appointments, you've met with your provider. That's something to discuss at your pre-op appointment. The implant, if you have questions about the type of implant or the procedure, those will all be answered for you with your provider. Again, just an example of kind of what it looks like to have that unhealthy hip and then the joint that's been replaced. We do the interior approach, direct superior and posterior options. Not all providers do all of them. So why they would do a certain approach on you is also very personal, depending on what you have going on. So those are questions we just want you to know, the types of approaches that are out there, and then those are conversations that you can have with the orthopedist. Again, the knee is here, so you might you also might see where this is a total knee, but you might see where they do a uni knee where they only replace part of it, the part that is bad. So again, just replacing that bad part of the joint that was bone on bone, so that you can have that nice mobility again. The knee is the hinge joint, so that movement, they're just restoring that movement for you. For our hips and knees, we do have the robotic Mako approach available, or a robotic approach. So this is very personalized. You actually have a consultation prior to surgery. There's a range of motion assessment. We don't all go into surgery having the same range of motion. It's a very precise arthritic bone removal. So they're, really assessing what part of your joint needs to come out. And then it's just minimally invasive. So that is just going to help with your recovery. The robot is still guided by the surgeon. So again, this is an example of the partial knee replacement. So the knee was still in line, and that just one side of the joint was bad. So just replacing that part, called the uni knee or the Oxford knee. So we do have our Joint Replacement Center here at Beaufort Memorial. We are an advanced disease certified specific program for our hips and knees, recognized by the Joint Commission, which is a seal for the National Quality of Approval. We are one of 4 in the state of South Carolina, and we also have the Blue Distinction Center of Excellence from the Blue Cross Blue Shield. So that is just a whole bunch of basically saying that we are, have been graded and have proved that we take care of our patients and give them the quality of care that these national organizations would like to see. So we're pretty proud of that. Our program is, we have an optimization process prior to surgery with our preoperative assessment clinic. This is an elective surgery, so you will usually go to our preoperative clinic. You'll be assessed. We want you to be in the best health possible before having this elective surgery to help reduce some of those risks and complications after surgery. So we really like to optimize you before. You will need a medical clearance before having this elective surgery. Our surgeries are usually 0 to 1 night stays. So that is also something you would talk about prior to having surgery and kind of know what your goal is. So a lot of these are same day. If you meet all of your goals, you could possibly go home the same day. We base our program on the wellness model, meaning you're not sick, you just have a sick joint. So we dress you in your regular clothes, get you up moving around very quickly, get you home as soon as possible once you've met all the requirements. And that just really does aid in your healing and your recovery. It's just, the studies show that it just helps you recover quicker as well, with less complications. So we do get you up and walking the day of surgery, usually within 4 hours is our goal. And then we definitely like to include your family, your first mate, your coach, your friend, whatever you want to call them. We will support you through the entire process. That is where I come in. I am a resource for you before surgery, during surgery, and after surgery, but we like to include your support system at home as well, because that's just going to help with the recovery and just help your outcome be that much better. So you've heard a lot today. If you feel like you're at the point where you would like to take some next steps in any way that may be, please don't hesitate to email me or call me, and I will be happy to point you in the right direction, and hopefully we can get you back to enjoying some of the things you love. Thank you.